Germany is back in a partial coronavirus lockdown. From today until the end of November, social gatherings will be limited to 2 households. Across the country, bars, restaurants, sports centers and entertainment venues have to remain closed. Hotels are prohibited from providing rooms to tourists. New daily coronavirus infections hit a record 19,000 at the weekend, and the latest measures come in response to what's being called an exponential rise.
One more round before lockdown. Sunday was the last chance for Germans to visit bars and restaurants before an enforced month-long closure. It's a heavy blow to businesses still struggling to recover from the first lockdown in the spring. The economic damage can no longer be measured. You can just forget this whole year, write this year off. This year isn't about making money anymore, it's just about survival and saving jobs. The German government has announced up to 10 billion euros of aid for businesses and the self-employed. It says the new measures are necessary to prevent hospitals from being overwhelmed. There are still enough intensive care beds available, but some areas are facing shortages of medical staff to care for rising numbers of coronavirus patients. And the government is desperate to avoid shutting schools and childcare centres. Instead, the focus is on recreation. The fresh closures and tightened restrictions on socialising come after low infection numbers over the summer allowed a return to relative normality. On Sunday evening, some took their chance for one last blowout, despite politicians' pleas to stay home. Chancellor Merkel once again appealed to the public in her weekend video podcast.
Liebe Mitbürgerinnen und Mitbürger,
dear citizens, we must do everything in our power to get the number of infections under control. We must face this test together and stand together in solidarity. Her unspoken promise is the prospect of family get-togethers at Christmas. But if infection rates don't fall, an extended lockdown can't be ruled out.
Let's get more now from our political correspondent, Thomas Sparrow. Thomas, coronavirus infections have been rising sharply in Germany. How's the health system coping at this point?
Terry, the main concern that German authorities have, both at the federal level but also regionally and locally, is the speed at which the coronavirus is actually spreading. New figures, for example, pointed to the fact that nearly 85% of German districts are now considered hotspots. So for now, Germany's health system has been able to cope with the coronavirus pandemic. But if the virus continues to spread at the speed at which we're seeing, then the health system will soon be overwhelmed. Another issue altogether is those regional health departments that are in charge of tracking, of tracing infections. And as we heard from Angela Merkel last week, Germany can no longer trace now around 75% of infections. So that gives you an idea, Terry, of just how serious the situation is here in Germany. And that explains also why we are now, as of today, here in Germany and until the end of the month, having a new partial lockdown.
Thomas, we heard Chancellor Merkel Sunday asking people once again to stand together in this crisis. Would you say that people in Germany are actually doing that? Are they accepting the measures that the government has imposed?
It's interesting because just before the new measures were introduced, a poll here in Germany was released and around 32% of those who were polled there said that the measures back then were not actually enough. So I would say that there is some sort of understanding that there is a need of further measures to be introduced, like the ones that we're seeing right now, even if that comes hand in hand with fewer freedoms for people, with the difficulties for people because they simply can't go to restaurants, they can't go to bars, they can't go to gyms and so on. At the same time, it's also important to stress that criticism is growing, and not only on the streets, also in the German parliament. We saw that last week as well. And there is also very evident coronavirus fatigue. In other words, people are really exhausted by the prospect of having to have another lockdown now in November. So there is a big question, Terry, as to whether people will comply with the rules and whether these measures that have been put in place will actually be effective.
Thomas, we've been seeing a massive rise in infections in Germany. How likely is it that this 1-month partial lockdown will have to be extended or that tougher measures will have to be imposed?
The goal that the government has, again, both federally but also regionally, is to avoid any comprehensive, complete lockdown. They want to keep schools open. They want to keep businesses open as much as possible. That's something that we've heard time and time again. Angela Merkel and the regional leaders will meet in 2 weeks' time to assess whether these measures that start today are actually effective or whether further measures are needed. For now, these are the measures that we have until the end of November.
Thomas, thanks so much for filling us in there. That was our political correspondent, Thomas Sparrow. Well, Germany, of course, isn't the only place implementing new restrictions as Europe faces a new wave of infections. France is currently reporting the continent's highest daily case numbers. In response, it has imposed the strictest national lockdown with all non-essential businesses closed and severe restrictions on movement. People will only be allowed to leave the house for essential work or medical reasons. Spain has implemented a nationwide curfew, but bars and restaurants remain open. People have to stay at home between 11 p.m. and 6 a.m. More severe restrictions are in place in regions with particularly high infection rates. And in the UK, the country with the highest death toll in Europe and one of the highest new daily case rates, the government has announced a new national lockdown to take effect starting Thursday. Non-essential shops must close. Bars and restaurants can only offer takeout. Schools, universities and construction sites, however, will remain open. Well, let's talk to our correspondents in the UK and France. Let's start with Birgit Maas is in London. Sonia Falnica is in Paris. We'll start with you, Sonia. So President Emmanuel Macron said France has to put a brake on the virus and has imposed a strict lockdown. How are people in France coping with that?
Well, this is France's, now second national lockdown in just 7 months. And I think, however, the restrictions this time aren't as severe as the previous one. For example, this time, schools and colleges are open, as are construction sites and parks, as well as certain small businesses like kiosks, like laundries and opticians. So certain services that are deemed essential. And I think as a result, there are many streets, at least here in Paris, though not busy, they aren't entirely deserted either. For instance, in my neighborhood, I still see people queuing up at noon outside popular bakeries, outside cafes that do take away. But of course, there is still a ban on private gatherings, on having visitors. People do need to still carry a sworn declaration form when they step out of the house. There are curbs on how long they can stay out. But I think people here largely do seem to understand the need for these renewed restrictions to curb rising infections. But it's true that there is a sense of fatigue, a sense of resignation among people, and I think also growing anger among people who have had to shut down their businesses yet again.
So some anger there in Paris and resignation too. Birgit, in London, Prime Minister Boris Johnson has announced a new lockdown in England starting on Thursday. People are all obviously anticipating that now. How are they preparing for it?
Boris Johnson is doing this to protect the NHS, to protect the health service. And I think this is something that resonates with people. People have had reports of, particularly in the north of England, of hospitals being already overwhelmed. They know that some elective procedures like hip operations or cancer care, that this actually can't be performed as it should be at the moment. There's a lack of beds and also a lack of staff. I spoke to one nurse from the north of England and he said he's very, very scared of the second wave and that the staff around him, that they're tired and they don't have the same energy as in the first wave. So I think a lot of people will understand that the health service needs to be protected. On the other hand, like everywhere else, there is a lot of fatigue and there's also growing criticism within Boris Johnson's own Conservative Party. We know that there are a lot of members of his own party in Parliament that are thinking of whether they're not going to vote for these new measures. There's a vote soon in Parliament, and we might see the scale of the unease reflected in that vote. So that's a place to watch out for how the country, how the UK is thinking about these new measures.
Birgit Maas there in London, thank you very much for your insights from there. We're hearing about fatigue and resignation and some anger also in France. Sonia Falnica for us in Paris. Thank you very much.